Hi, I'm Jordan Crutchfield. I'm an FNP student at Eastern Kentucky University, and today I will be discussing integrative therapy as an intervention strategy for substance abusing pregnant women. According to the World Health Organization, approximately 33% of women of childbearing age, ranging between 15 and 44, admit to some form of illicit drug use. Furthermore, 11% report use within the last month. Keeping these statistics in mind, it is easy to see that in utero exposure is inevitably likely to occur, whether knowingly or unknowingly. It is important to note that these numbers may be much higher in actuality, as the statistics reflect only those that report substance use. Research also suggests that high-risk vulnerable populations, such as rural and underserved areas, as well as heavily urban areas, are at a much higher risk for substance misuse during pregnancy. The list is exhaustive related to negative effects of substance abuse surrounding gestation and after for the baby, but just to name a few: premature delivery, placental abruption, low birth weight, neurological impairment, mental retardation, and learning disabilities can all result as a result of substance use. Many local, state, and national healthcare goals surround maternal, infant, and child well-being. The risk of infant maternal mortality as well as pregnancy-associated complications can be reduced by providing needed resources such as increased access to quality antepartum care and social support infrastructures for mothers that struggle with addiction pre- and post-conception. Many researchers define pregnancy as a window of opportunity for substance-abusing pregnant women. This could be related to the mother's increased motivation to seek care out of concern for the growing fetus. This window of opportunity affords the advanced practice nurse to intervene appropriately and hopefully will instill a positive view of health by equipping the mother with the skills needed to attain and maintain a substance-free lifestyle. Recognizing that substance abuse is multifaceted, it was easy to see that a multidisciplinary approach to intervention strategies would be ideal, and this instigated the literature review. So the studies that I used in my research were 2 prospective cohort studies and 1 retrospective cohort study. Both the prospective cohort studies suggested that participation in integrated substance abuse treatment programs in conjunction with prenatal care significantly improved neonatal outcomes. The retrospective cohort study did not use a pregnant population. However, the themes determined from the study are applicable as the demographic profile is similar. Ultimately, the researchers found that integrated programs should include tailored interventions, as doing so increases the likelihood that participants successfully remain engaged, are motivated, and retained in treatment programs. As multi-layered as drug use in pregnancy is, it is that much more important that the advanced practice nurse recognize that each individual and circumstance is unique, and intervention should be tailored to meet the individual where they are with flexibility maintained. Information gleaned from the literature should be used to aid in devising care plans, but not for overgeneralization of a demographic or population. Advanced practice nurses should also continue to educate about available resources for supports, particularly related to substance abuse and pregnancy. Additionally, education about the potential complications mother and baby may face as a result of continued use, as represented by the literature, should also be emphasized when interacting with patients. Once we're able to anticipate barriers and perceptions from a particular demographic or population, we're better able to plan interventions that suit the individual. And so, therefore, we should take the information we gleaned from the literature and apply it as needed to our patients. In the case of the substance-abusing pregnant population, an intervention that may be used to change nursing practice would include equipping nursing staff located at outpatient obstetrical clinics with an additional component of psychosocial cognitive behavioral therapy training with which to incorporate into prenatal visits. It could encompass an assessment tool that allows the nurses to be facilitators of substance abuse treatment therapy. RN staff training could be conducted by specialists in substance abuse fields, ensuring that staff are adequately prepared to deliver and maintain therapeutic communication. It is a cost-effective intervention that provides an opportunity for patient health and safety to be optimized. The approach of integrating substance abuse therapy in conjunction with prenatal care maintains a holistic approach, addressing the needs of the patient while also surveilling fetal and maternal well-being throughout.